I'm Frank Diamond, the managing editor of Infection Control Today. We're helping infection preventionists and others on the front lines of infection control and prevention as they battle COVID-19. And one of the ways we're doing that is by reaching out to infection control experts, such as my guest, Sharon Ward-Fore. Sharon is an infection prevention consultant who's helping infection preventionists by sharing her knowledge about how to tackle the unique challenges that COVID presents. We here at Infection Control Today are also lucky enough to have Sharon on our editorial advisory board. Thanks for stopping by, Sharon.
Hi, Frank. Thanks for having me.
Let's talk a little bit about what the future may hold for infection preventionists because of COVID. Do you see infection preventionists migrating outside their typical workplaces like hospitals and other traditional healthcare settings and going to places like corporations, grocery stores, hair salons, restaurants, you name it? And in addition, you witnessed some of these places try to interpret the CDC rules, and you said it makes you cringe. Why? And might that mean they'll consider hiring infection preventionists, or at least in some way tapping into the expertise that infection preventionists can offer?
So in my dream world, it would be really nice if infection preventionists or epidemiologists who have knowledge of ways to protect yourself were included in some of the discussions for corporations and hair salons and things like that. Infection prevention in a healthcare setting is, I won't say it's limited, but there's not a lot of opportunities for growth beyond maybe being the lead IP. So perhaps looking to the future, these would be areas where IPs could look to grow and maybe move out of healthcare into these ancillary institutions. And then the second part of your question, yes, I think I've seen some things that have made the hair on the back of my neck stand up, just being out and about in places like warehouse clubs and discussions with other people. So for example, I was at a big warehouse club waiting in line to get in, and half of the staff had face shields on with no mask. So OSHA says when you wear a face shield, you need to wear a mask. The other half of the staff had cloth face coverings on below their nose. So those kind of things give me pause, because we are still in a pandemic. And as we're beginning to see, we've reopened, and I understand it's important for the economy to come back, but I'm worried that we're all playing infection preventionist and not really adhering to the best practices for wearing this PPE. And I wonder, at places like this warehouse club, who's teaching the staff how to properly wear this stuff? Another example is, I was talking to my nephew the other day, and he's been furloughed, but now he's returning to work. And he works in a open office space setting. He's been told he has to wear a mask in the common areas if he gets up from his open desk setting to go to the restroom or the kitchen, but he doesn't have to wear his mask at his desk, which is, literally 3 feet from the person next to him. So again, I know everyone's trying to do the best they can, but I'm just wondering if there would be a way for IPs to step in and provide specific guidance for these specific types of scenarios.
And we're not even talking about IPs possibly doing this as a career move. I'm sure you and other IPs would gladly do it for free, although it's not bad to get paid for your expertise.
It's not.
But how would what would you imagine them, how would they be able to do that, maybe step in? Or have you figured that one out yet?
So I haven't quite figured it out, but I think from a consultant perspective, or, even just saying, hey, my nephew works here. Do you mind if I come in and look at your facility and maybe give you some tips on how to do things a little better? I know corporate America is struggling at this point in time, and I don't really foresee them willing to take on any more expenses. But I have to wonder, when places like hair salons are monitoring patrons' temperatures, are they understanding their level of risk legally? Because you're saying now I'm going to be responsible for calibrating this thermometer, making sure the staff is properly trained to use it. And then if there's a reading, then you have to let that patron know, oh, we noticed you have a fever. So it's not simply just take someone's temperature and say you're fine, because unfortunately with COVID, we know now the terminology is pre-symptomatic and or asymptomatic people. So there's a bit of liability there, I think, that a lot of places aren't factoring in.
I just want to say, as an aside, if you can, if your nephew would go along with you, actually go into his workplace, you're a better person than I am, because if I tried that with my daughter, there'd be hell to pay, I'm sure. But so where do you see it playing out as far as infection prevention maybe be more aggressive in trying to tell people that we're here if you need us? You're a consultant, so how are you specifically going to handle this?
Well, there's a big corporation down the street from me where my daughter works, and I'm going to contact one of the VPs and offer my services for free. I definitely have special interest in this, because as they bring her back into the workplace, it then puts me at risk. And I just want to make sure they understand that indoors is risky. It's still risky, and that they need to be aware of that. And even though they're going to do all the right things, monitor temperatures and so on and so forth, there's still an element of risk. And I mean, theoretically, the best barrier protection is to wear a mask, right? And hand hygiene, of course. So that's what I'm going to try and do. We'll see how that goes, and I'll let you know. But I think I would like to see maybe more specific guidance from higher up, from CDC, saying that, it's not a one size fits all standard, and that every opportunity to open needs to look at their individual situation. And I almost think that maybe in the future, it could be like, we have restaurant healthcare inspectors that go and inspect every restaurant for food safety. Maybe down the road, we need to think about something like this for infection prevention protocols. So maybe it's a public health initiative where, if this is our new normal and we're going to be in this for the long run, then maybe now is when we put that team together to then fan out to these areas and make sure that when they're reopening, they're following best practices. And since they're not healthcare, they don't really know what those are. And again, it's not one size fits all.
It's interesting. So there might be a place for infection prevention to be part of public health organizations.
Right.
Has there been any reaching out one way or another, or are people just too busy dealing with the situation at hand?
I think they're very busy right now. In Chicago, we were flat, but now we're starting, as we're reopening, as probably you're in New York, right, Frank? You're starting to see a little bit of uptick.
Outside of Philadelphia, actually.
Outside of Philadelphia. Okay, so you're probably okay for now till those New Yorkers come in again. So I think they're very, very busy with that, but it's certainly something I'm going to talk to our public health people about and see if they're thinking about that again, because in Chicago, we've just reopened indoor dining, and I was actually appalled to see what was going on. And again, indoors is much more risky than outdoors. And outdoors is still, there's a level of risk, because I've seen where outdoor restaurants are placing their tables and they're measuring their 6 feet from table to table. They don't account for the fact that there's a minimum of 24 inches on each side of that table for a patron to sit. So when tables are adjacent to each other with 2 chairs, now there's about 30 inches between people, not 6 feet. So I'm sort of concerned that they're trying to do their due diligence, but they're sort of missing it in some respects.
And how do you see, when you see this, do you have to hold yourself back from telling the restaurant owner that you're not doing this right, or it must
Yes.
be obviously gets to you to see this?
I see it, and I just put that on my list of a restaurant I will not be a patron of, because I know they're trying, but it's, for me, it's, and for most people, it's just too risky. It's too close. I think people have sort of given up, and they've said, you know what, I have been locked down too long. I'll kind of sort of wear my mask, but my local officials have said as long as tables are 6 feet apart, it's safe. But I think the messaging needs to be, I think the messaging is vague, and I think there needs to be maybe like a fact sheet or a tip sheet that goes with this. You know, don't go into a restaurant where your chair backs up to the person behind you. Make sure it's a minimum of 6 feet between tables, and maybe there should be an empty table between you when possible. And if they can't do that, then maybe you want to go somewhere else to dine out. Same thing with gyms. You know, it's great that you're in a gym and your treadmill is 2 away from the person next to you, but think about the volume of respiratory droplets that are being exhaled during the course of that workout. Barriers between those kinds of treadmills would be great, plexiglass barriers. But from what I've seen in some places, they're just simply allowing for that spatial separation, which under normal respiration would probably be fine. But during a workout where you're, you know, breathing a little more heavily, I think there's a level of risk there that we're not taking into account. And I just wish our experts would give guidelines that aren't so vague.
What level of expertise would satisfy you to see in corporations and companies, in restaurants and hair salons, and any other place that is going to be a place where people gather, and therefore a place where there's possible risk of COVID-19? By level of expertise, you mean there simply aren't enough certified infection preventionists to go around, I think, as is. So do you foresee at least some kind of, would it make you happy to see at least some kind of infection prevention training for at least 1 or 2 employees on those sites? The kind of, sort of like the way CPR is done now, where an employee or 2 knows about CPR, but they don't necessarily have a healthcare background and that sort of thing. Would that satisfy you?
It would. It's kind of a train the trainer sort of scenario where an IP trains, or at least provides education to maybe managers, and managers designate someone as the local IP. Sort of like when you're in an office building, you have your fire safety team. You know, someone's the searcher, someone's the one who gets everybody out. So that kind of thing is part of maybe life safety moving forward. I think train the trainer would work really well. Without, I mean, you don't really have to get into the nitty gritty of it. Just explain the use of barriers and hand hygiene and masking, and what's an appropriate way to wear your mask and what isn't. So I think, yeah, that's a great way to do it.
And this would not overlap with the ongoing debate within infection prevention. I know infection preventionists want to see certification. They believe, for the most part, that infection preventionists in the healthcare setting should be certified, and not every healthcare setting has an infection preventionist who's certified, although they might call that person an infection preventionist. But the rules, if I may paraphrase what I think you're telling me, the rules could be bent a little bit for somebody who's working in a company that's not a healthcare, a restaurant, a hairstylist. All they need to do is A, have some training in infection prevention, and B, have a hotline to a trained infection preventionist.
That would be great. And we would never expect those folks to be certified, but certainly to be able to reach out to, for example, our national organization, APIC. APIC has a consulting division where, you know, you could have someone come out and do a walkthrough on your facility and help you understand maybe what's needed, or tell you how great you've set things up. And then that kind of consulting service could provide education to whoever is deemed to be that IP on that floor or for that department. So you would never certify those folks, because the certification process is 2 years of actually practicing infection prevention. but to help them understand the importance of barriers and hand hygiene would be really, really important. And I think it would go a long way to helping begin to recontain this pandemic, because now we're open and it's going to be hard to put that genie back in the bottle because people are out and about and they're not really seeing what's happening, and life as they know it has pretty much returned to normal, but it really hasn't.
Right, right. Anything else you want to add about this topic, Sharon?
I will get back to you on how successful I am with my daughter's company and let you know how that's received. But I think
you have a great relationship with your daughter, because as I mentioned,
yeah.
my daughter doesn't only come within 10 miles of where she works or anybody she works with. That's just the way it is. So I salute you on a great relationship with your child. I have my child, but there's definitely boundaries.
Well, you know, moms are prone to embarrassing their kids. So, you know, if I embarrass her, it'll be for the greater good.
Sharon Ward-Fore, thank you. Always a pleasure talking to you. Always informative talking to you. A member of the Infection Control Today's editorial advisory board. Thank you, and stay safe, please.
Thank you. You too.